response to primary care provider shortages, really originally focused on our rural communities, but has since expanded to include all of our underserved communities, rural, urban, and otherwise. All AHECs across the country are funded through the federal government, through the Federal Health Resources and Services Administration, also called HRSA, which I'll be talking a little bit about more later in this presentation. And what do AHECs do? Every AHEC is a little bit different, but most of us do things like community experiences for health profession students, pipeline activities for high school students to encourage them to explore careers in healthcare. Maybe some of you participated in a health career camp when you were in high school. We do some continuing education for already practicing providers. We have a program, a national program called the AHEC Scholars Program, which I'll talk a little bit about at the end of the presentation. And we also do other trainings like community health worker training and other things like that. So as we begin to think about loan repayment and scholarship options, just some kind of 101, some basic information of why these programs exist and what they look like. So the federal government and many state governments offer loan repayment or scholarship programs and opportunities for health professionals. And these programs tend to have a focus on providing care in underserved communities. They're really designed to be an incentive to assure that there is an adequate healthcare workforce in our underserved communities. These programs basically consist of payment of educational expenses or repayment of loans in exchange for a certain amount of time in an approved practice site. Just to clarify, any scholarship or loan funding is separate from and in addition to the compensation that you would receive from your site. So it's separate from your salary that you would negotiate directly with your employer or the site where you're working. And all of these are very competitive programs. Of course, everyone is interested in scholarship and loan repayment opportunities. Some of them are based on need, some of them are based on priority areas. I'll talk a little bit about that as we go through them. And of course, they're also dependent on availability of funding from the government agency that's providing the funding. Some definitions that are helpful to keep in mind as we think about these loan repayment and scholarship opportunities. So HRSA, the organization that funds AHECs, the Health Resources and Services Administration, also oversees a lot of these federal loan repayment opportunities. They have a designation called a shortage designation. And these designations identify, could be a geographic area, a population, or a healthcare facility that's experiencing a shortage of healthcare services or providers. There's a bunch of different types of shortage designations, and it's just important to kind of know what these are as you're exploring these opportunities, just so that you're familiar with what some of these acronyms stand for. So there's types of shortage designations. One is referred to as a health profession shortage area. You'll hear the term HPSA. And then there's also MUAs and MUPs, which are medically underserved areas and medically underserved populations. Those are the two I'll talk about a little bit more today. There's also things that are called exceptional medically underserved populations and governor's designated secretary certified shortage areas for rural health clinics, which is a mouthful and probably needs its own acronym. And these are important to think about because as the providing agencies, as the government agencies that are designing these loan repayment and scholarship opportunities are looking at priority areas, it's important to understand that folks who are residing in these areas of underservice are extremely more likely to be living in poverty than those in non-designated areas. So just a little bit more information about HPSAs and MUAs. So as I said, a HPSA is a health professional shortage area, and it can be geographic, it can be population specific, or even facility specific. And there are different HPSA scores referring to the shortage of either primary care providers, dental providers, or mental health providers. Basically, there's a number of factors that go into creating a score for these areas that range from 1 to 25 for primary care and mental health, and 1 to 26 for dental health. And so basically, the higher the score, the greater the need and the greater the priority. And you'll see in some of these loan repayment opportunities, there is priority given to folks who will be practicing in sites with higher scores, with more demonstrated need. So just as an example, looking at a rural site, in Bayfield County, Wisconsin, there's a health center called the Lakes Community Health Center. And you can see on the screen here, they're kind of in the middle for primary care, but pretty significant need for dental and mental health care providers. And then if we look at Project Home, which is a federally qualified health center here in Philadelphia in an urban community, pretty well covered for our mental health, with a score of 6, but really almost at the top of need for dental. So you are able to kind of look up these scores and help you understand where the priority areas are. Also, just a brief explanation of what's referred to as an MUA, a medically underserved area. These refer to, again, geographic areas and populations with a lack of access to primary care services. There's an index that's created, a score of 62 or below qualifies an area or population as medically underserved. Some of the factors that go into that are provider to population ratio, percent of the population at or below the federal poverty level, and some other factors. So, great. So now we know, okay, there's areas with extreme need for providers. We know that government agencies want to ensure that there's an adequate healthcare workforce in these communities. So what is the response? So we can think about these opportunities as incentives for underserved service, for providing care in these underserved communities. So I'm going to go through all of these, kind of each one. Some I'll share a little bit of information with, some I'll share a little bit more. At the end, I'll give you some direction of where you can go if you're looking for more information. So we can think about kind of 4 chunks of incentives that exist for underserved service. So first off, there's federal scholarship programs. So we're thinking about scholarship programs, that's funding that's paid to your academic institution while you are in school. So we're going to talk about the Nurse Corps Scholarship Program, the Native Hawaiian Health Scholarship Program, and the largest one, the National Health Service Corps Scholarship Program. There's also a number of federal loan repayment programs. So we'll talk about these, the Nurse Corps program, the National Health Corps Loan Repayment Program, and then some specific programs, substance use disorder treatment, pediatric specialty, and faculty loan programs. I'll touch really briefly on some other federal sources of loan repayment, as well as some state-specific opportunities that may exist in your state. So we're going to start with those scholarship programs. So those main 3 scholarship programs that are offered by the Health Resources Services Administration. So first, we'll talk briefly about the Nurse Corps Scholarship Program. So obviously, this is for students in nursing programs. This program pays tuition, fees, as monthly stipend, and other educational costs. Upon completion of your academic program, you must work at what's referred to as a critical shortage facility after graduation, which is really kind of a facility in one of those medically underserved areas that I talked about. It does require a 2-year service commitment for 1 to 2 years of scholarship support. So either if you get 1 year of scholarship support or 2 years, you are required to complete 2 years of service commitment. There is sometimes additional funding available to extend beyond that. for a maximum of 4 years of support. And for each additional service commitment year, it's additional 1 year additional service commitment for each additional scholarship year. So for beyond those kind of first 2 years. This program does prioritize students with financial need in specific priority areas of practice. For the 23-24 academic year, the priorities were women's health, entry-level careers into nursing, and careers, folks who are in nurse practitioner programs with a specific focus on psychiatric mental health nurse practitioners. I would expect that the applications for this program for the 24-25 academic year should open early in the calendar year. Another scholarship program is the Native Hawaiian Health Scholarship Program. Again, similar, this covers tuition, a monthly stipend, and some other educational costs. Upon completion of your program, you must serve for 1 year in a medically underserved area within the state of Hawaii. The scholarship is for Native Hawaiians. You can see the list on the screen of the disciplines that are eligible: clinical psychologist, dental hygienist. I won't read all of them, but it does have a variety of professions included. This is a competitive and merit-based award, and that application, again, typically opens every winter. So the largest scholarship program that you may have heard about is the National Health Service Corps Scholarship Program. So this National Health Service Corps is under that Health Resources Services Administration umbrella and administers scholarship and loan repayment programs. It's been around for quite some time. So this scholarship program provides payment for up to 4 years of tuition fees and what's referred to as reasonable educational costs, things like books or other expenses. Does include a taxable monthly stipend. A few years ago, it was just under $1,500. It does require a 2-year minimum commitment. And it is for folks in the following specialties: family medicine, general pediatrics, internal medicine, OBGYN, and psychiatry. Upon completion of your academic program and residency, then you must choose a practice site on the approved list. And as I mentioned before, compensation is separate from your scholarship funding. You negotiate that directly with your employer. For these scholarships, some of them scholarships and some of the loan repayments require different citizenship requirements. For this NHSC scholarship program, U.S. citizenship is required. You must be either accepted or enrolled in medical school, an NP program, a nurse midwife program, a PA program, or dental school. This application typically opens early in the calendar year. As you can see, about 10% of applicants receive this scholarship funding. It's highly sought after and certainly is competitive. So as I mentioned, upon completion of your training, you would choose a practice site in one of these HPSAs, these health profession shortage areas that I talked about. There is an approved list. There is a process to get a site approved that's not already in the list. If you don't choose one will be assigned to you. And there is both a full-time option and a part-time option. The part-time, obviously, you're just going to have double the time frame of your commitment. For all of these scholarship and loan repayment programs, there's some pretty serious consequences for breach of contract. So, for example, if you participate in the NHSC scholarship program and don't complete your academic program, you are required to repay all of the funds that you received within 3 years. If you do complete your academic training and fail to comply with the contract, you can be liable for the amount that you received plus interest. They can multiply that by 3. So there's some pretty significant consequences to not following through with the service commitment portion of all of these programs. So those are scholarship programs. Those are programs that you can explore and apply to while you are in your academic program. Then there's also a number of loan repayment programs. So I'll talk first about the federal HRSA loan repayment programs. You can see here there's quite a few of them. Again, there's a separate program, the Nurse Corps Loan Repayment Program, the National Health Corps Loan Repayment Program, Substance Use Disorder Treatment and Recovery, Pediatric Specialty, and Faculty Loans. So I'll talk through each of those briefly. So the Nurse Corps Loan Repayment Program can pay up to 85% of unpaid nursing education debt. It does have a service requirement of at least 2 years to be eligible. For folks who are RNs, advanced practice nurse practitioners, or nurse faculty, and the application for this typically opens early in the calendar year. And then we have the National Health Service Corps Loan Repayment Program. So there's kind of a subset of 4 programs within that. It is kind of lots of different categories. So I'll talk about the ones that in this subset as well. So under this National Health Service Corps Loan Repayment Program, there's as you saw on the previous screen, there's a number of different subsets within this. They all have varying eligibility amounts and service commitments. They all tend to offer both full-time and part-time options. Just to be clear, payments are received directly to you, to the applicant, not to your loan service provider. Those payments, thankfully, are exempt from federal income taxes, and they're just kind of paid as a lump sum. The application for these tend to be late fall, early winter. To be eligible for these, U.S. citizen or a U.S. national, you must have a current unrestricted health profession license in your field, be eligible for federal employment, be employed by or have accepted a position at one of these approved sites. And again, failure to complete your obligation for these National Health Service Corps loan repayment programs does come with some pretty serious consequences. Repaying loan amounts, a fine of $7,500 per month of service not completed, plus interest. So pretty hefty consequences for not fulfilling the service obligation associated with these. So remember when we talked about those HPSAs, those health profession shortage areas, you can see here under those primary care HPSAs, you can see that includes family medicine, general internal medicine, general pediatrics, OBGYN, geriatrics, and psychiatry. And then within a behavioral health HPSA, we're looking at psychiatry. So the general NHSC loan repayment program provides up to $50,000 for full-time service or up to $25,000 for part-time service for a minimum 2-year commitment at any NHSC approved site. In terms of priorities for this NHSC loan repayment program, interestingly, priority is given to folks who receive that NHSC scholarship that we talked about earlier. Remember, some folks get that scholarship for 4 years, some folks only get it for 1. So folks who have participated in that program are given the first priority. Then they're reviewed and approved by descending HPSA score. So remember, the higher the HPSA score, the higher the need. So the highest priority is going to folks who are going to practice in those highest need sites. And then other things that are looked at are the background of the applicant themselves. Priority is given to applicants who come from a disadvantaged background themselves and who have what's referred to as characteristics likely to remain in a HPSA. So as we mentioned, the goal of these programs is to really ensure that we have an adequate healthcare workforce in our underserved communities. And we don't want that to be a transitory healthcare workforce. We want people who are going to put down roots and stay and work in these communities long term. So, for example, if someone has completed a HRSA-funded training program or has demonstrated other experience or dedication towards working in underserved communities, that's going to be beneficial to an application for the NHSC payment program. There's all different kind of sites that are included in these approved sites. The most common is what's referred to as an FQHC, which is a federally qualified health center. But there are other sites that can be approved, things like community health centers, health departments, school-based clinics, and others that you can see on the screen here. Within this National Health Service Corps loan repayment, there's these subsets. So one is called the Substance Use Disorder Workforce Loan Repayment Program. So you can see that's a higher amount of funding. It's up to $75,000 for full-time service with a minimum 3-year commitment. But again, then you're looking at specifically substance use disorder approved sites. Again, priority goes to folks who participated in the scholarship program. And then there's some other priorities, things like type of clinician, depending on the greatest need, HAWAIIAN score of the facility, and the substance use disorder credentials of the clinician themselves. Again, a wide variety of approved sites like the previous program. Another NHSC loan repayment program is called the Rural Community Loan Repayment Program. You can see, again, an increase in funding, which relates to increased need in our rural communities. So up to $100,000 of loan repayment for full-time service with a minimum of 3-year service commitment. And then that is specifically rural substance use disorder sites. So kind of narrowing down the specificity of the sites that would be eligible. Again, priority given to folks who have participated in the scholarship program. Then there's a specific type of site referred to the Rural Communities Opioid Response Program. So sites in that program receive priority. Again, looking at the need demonstrated by the HAWAIIAN score. And then looking at additional priorities like the substance use disorder treatment credentials of the provider and the HAWAIIAN score and the background of the provider themselves. Again, a wide variety of approved sites for that program. So this is just kind of a nice little comparison of these HRSA loan repayment National Health Service Corps loan repayment programs. So you can see the variety of disciplines that are eligible for all of these programs. So physicians, nurse practitioners, PAs, certified nurse midwives, and so on are eligible for all of these. And then you can see dentists and dental hygienists are also eligible for the broadest, that first category on the left, the loan repayment program. And then as we're looking at those substance use disorder and rural community loan repayment programs, we're seeing some opening up for substance use counselors, pharmacists, and registered nurses. You can see the variety of award amounts and the service commitments there. And important to notice at the bottom here, all of these National Health Service Corps loan repayment programs use only one application, but you can only apply to one program. So you can't be enrolled in 2 programs at the same time. There's also something called the Student to Service Loan Repayment Program. So students in their final year of school can receive loan repayment assistance up to $120,000 based on funding availability. If you are planning to complete a primary care residency in family medicine, general internal medicine, general pediatrics, geriatrics, OBGYN, or psychiatry. And this student to service loan repayment program does have a service commitment of 3 years of full-time service or 6 years of half-time service. So significant commitment, but significant funding available as well. So we talked about this minimum 2-year commitment for these loan repayment programs, full-time and part-time options, and that the payments are made to the recipient directly as a lump sum and are exempt from federal income taxes. For these loan repayment programs, for some of them, they do vary the amount of repayment available based on HPSA score. So facilities with higher HPSA scores may have higher repayment opportunities available. There's also the Substance Use Disorder Treatment and Recovery Loan Repayment Program. This is separate from the previous substance use disorder program. So this is called the STAR Loan Repayment Program. Again, repaying eligible educational loans in exchange for work in a full-time substance use disorder treatment site. It is full-time 6-year service requirement. And your role must involve direct patient care in a county or municipality where the average drug overdose death rate exceeds the most current national average, or it's in a mental health professional shortage area. There's also a pediatric specialty loan repayment program, again, specifically for folks in a pediatric specialty, subspecialty, surgical specialty, or child and adolescent mental and behavioral health care, including substance use disorder prevention and treatment. There's also a faculty loan repayment program that will repay up to $40,000 in return for service at an eligible health profession school. This is focused on folks who come from a disadvantaged background themselves and are a faculty member at an approved school. So that's a lot of information. There are some other federal sources of loan repayment. We've all heard about the Public Service Loan Forgiveness Program. So that's also available. And then there's some other loan repayment, and this is just some examples. NIH has some research-based loan repayment programs, such as the AIDS Research Loan Repayment Program, a clinical research loan repayment program, and a pediatric research loan repayment program. There's also what's referred to as the Indian Health Service Loan Repayment Program and the CDC Educational Loan Repayment Program for health professionals. There's also state-specific programs. So states can receive funding from the federal government that they can use to administer loan repayment programs specific to their state. To find those opportunities, each state has what's referred to as a primary care office. If you scan that QR code, that will take you to a landing page where you can search and find your state's primary care office. So just some final thoughts. This was a lot of information, and the goal of this session isn't for you to be able to recite the number of years of commitment in exchange for a certain amount of loan repayment. The goal is to understand that there's a wide variety of scholarship and loan repayment opportunities available, specifically if you're interested in working in an underserved community. These really are excellent options if you are sure of your career path. All of these programs are competitive, and they're all dependent on funding budgets. You should check the dates and eligible amounts. Sometimes those amounts change based on funding, as well as priority areas. For example, that nurse scholarship program last year was focusing, one of the priorities was nurse practitioners in psychiatric or mental health specialties. That might change. So it's good to look at what those priority areas are as the applications open. Most importantly, all of these programs have very severe consequences for defaulting on the programs, for either not completing your academic program or more severely, completing your academic program but not fulfilling your service requirement. So these really should not be taken lightly. And as the first bullet says, if you're sure of your career path, if you know that you're going to go into primary care, or you know that you are planning on providing care in an underserved community, they're really great options. But if you're unsure or kind of thinking about where you're going to go, you might want to reconsider them, because they really do have serious penalties attached. So if you are interested in working in underserved communities, or just kind of exploring that option, there is a program called the AHEC Scholars Program. So as I mentioned, there's AHECs all across the country, in every state, and every AHEC has a scholars program. So that QR will take you to a page where you can find your state's AHEC. And then you can connect with them. You can learn about their scholars program. All of the scholars programs are run a little bit differently, but they all focus on things like care in underserved communities, moral competency, social determinants of health, integration of mental health services into primary care. So they're all covering some of the basic same core topics. So I'd encourage you to explore your local AHEC and your scholars program. So you can see my name and email here on the screen. Feel free to reach out to me. If I don't have the answer to your question, I can help you find it or point you in the right direction. The QR code on the left, again, can help you find your local AHEC. Aside from the scholars program, we often can help connect students with clinical opportunities, some more information about perhaps state-specific loan repayment opportunities that might exist, and some other trainings and opportunities that might be of interest to you. And then the QR code on the right will take you to the Health Resources Services Administration page, where you can learn more about these scholarship and loan repayment opportunities, specifically those nitty-gritty details of when is the application due, what is the maximum loan repayment or scholarship amount, what are the required years of service, and so on. So I am going to go ahead and stop sharing now. So feel free, if you have any questions, you can drop those in the chat. Michael, I'll turn it over to you to kind of facilitate the questions, if that's okay.
Yep, definitely. Yeah. Okay. So I guess the first question is that, are there any medical scholarships for undergrads that you're aware of?
So for scholarships on the undergraduate level, I would encourage you to connect with the academic institutions. I would think that funding would be connected to your academic institution. So, you know, if you're thinking about a pre-med, like thinking about a pre-med program, that's where you would look for those. These scholarship programs are really for medical school.
Cool. Gotcha. Okay. And then there's another question. I guess this is kind of a clarification question regarding the presentation. So like, is the HPSA loan forgiveness of up to $50K for a full-time 2-year commitment per year dollar amount, or a total up to 2 years?
A total amount. And as I said, those amounts do change sometimes. So if you're interested in applying to those, I would encourage you to go ahead and go to that, go to those national websites and explore the application. They're not open right now, but if you go ahead and look, you can always see the previous year's application. So you'll get a kind of sense of what to expect in the coming year.
And the next question is, do we have to be an alumni of the scholarship program to apply to the loan repayment program?
You do not. So priority for those loan repayment programs is given to students who have participated in the scholarship program, but is absolutely not a requirement. So if you did not participate in the scholarship program, or perhaps you applied and didn't receive the scholarship, absolutely, that does not exclude you from participating in loan repayment.
Great, thank you. And then the next question is that, do you know of any scholarships or loan repayment programs for physical therapy at the career path?
So most of the ones that we went through today are for folks who would be in primary care or related. I think you might want to consider the national service loan repayment program for that one. And that would really be site specific. So let me just get the name right for that one. So you would probably be looking at, find the name really quickly. I'm not finding it, but I will. It's kind of the general one that anyone would be eligible for, even for just kind of working in a nonprofit, and that would be site specific. So you would be really thinking about what sites would be eligible for that. So maybe a government clinic or something like that, because if you're thinking about a lot of PT clinics would not fall under that category.
Right. Okay. And then the next up question is actually one of our attendees asked that, like, are there any programs that you're aware of for international students? Since like most repayment programs are actually like for US citizen or national only.
And when we're looking at government funding, that's going to be a roadblock for international students. The government funding does require that folks are either US citizens or US nationals, permanent residents, or other designations. So I'm not aware of any programs that would be specific for international students. You might want then to start looking at private scholarships that might have a little bit more flexibility in terms of eligibility.
Right. Thanks. And then there was a participant that asked, I recently graduated from a MPH grad program and I'm struggling to like repay loans. And she's wondering like, what are the best way to go about it?
Yeah, so again, depending on where you are employed, even if you aren't a direct care provider, so I also have an MPH, so a lot of us are not providing obviously direct clinical care. So again, then you might be looking at that kind of general loan repayment program. Not provider specific. So if you're working at a county government level or a nonprofit organization, you might be eligible for the general federal loan repayment program. That one does come with more hoops to jump through. You have to have like, a certain number of payments made on time. There's more roadblocks to that one, but for folks who aren't in clinical care, that might be your best option.
Great, awesome. I guess like the next question is that I guess like we briefly skimmed through this one, but are there any like loan repayment programs available to students from like are loan payment programs available to students of all income levels?
Yes, absolutely. So most of these loan repayment programs, the priority is on the need of the site as opposed to the financial need of the applicant. Some of them, particularly the scholarship programs, do take more into account the financial need of the applicant, but for the loan repayment, again, so these programs have different goals. So the goals of the scholarship program, while it does include increasing the healthcare workforce in our underserved communities, they also might be looking to increase the diversity of the healthcare workforce and using diversity in all senses, possible, including economic diversity and the background of the applicants. The loan repayment programs really are looking at getting folks in sites. So they want folks who are ready to go, ready to hit the ground, start practicing to get into these sites that have demonstrated need. So really the highest priority there is the need of the site, those scores, those HPSA scores. So the higher the score of the site, the greater likelihood that you may be eligible to participate in the program.
Right. There's one last question for the day. So one of our attendees is wondering if we can discuss a little bit more on if, to your knowledge, scholarship program offered by the Veterans Administration.
So that's a great question. I am not aware of the specifics of any of those programs. If that person wants to email me directly, I can put my email up in the chat again really quickly. And anybody, if you have any additional questions, I'm happy to look into those for you. I just put my email in the chat. So feel free to email that question directly to me, and I can help find that information for you.
Great. Yeah. Thank you so much, Christine, for your amazing presentation and honestly all the insights that that basically like just happened during those past 45 minutes. But yeah, really appreciate it. And everyone, hope you enjoy this first session of NPHC, and our next session is going to start really soon.
Thank you so much for having me, and